Hey everybody, it's Dr. David. Sorry I'm a couple minutes late there. Had a couple of technical difficulties. For those who don't know, I am Dr. David, holistic pediatrician in Tampa, Florida. And this will be a 1 hour or less, depending on how many questions we have. Ask Dr. David live. So we've already received some questions that we will go over, but of course, we are always open for questions that come in. So you can hit us up in the chat there and we will be happy to talk about it. So now it is important for us to also remember that this is for educational purposes. We do not answer specific questions for a particular patient, nor are we giving specific medical advice for one individual. So there'll be general concepts that we will be talking about there, but always want to have that little disclaimer there for you. Alrighty. So waiting for the first question here to get entered. Oh, okay. First question. So, did you get the bivalent COVID vaccine? Okay. So, I'm sure most people know by now that as of September Labor Day, a new version of the COVID vaccine came out that covered for Omicron species. And it does seem to be doing very well in terms of providing coverage for Omicron and the BA4s and the BA5s and the subvariants that have come out since then. So, does it provide protection against those? It does. How long does the protection last for? Similar to the other vaccines when they first come out, we don't know. But do I suspect that protection will wane over time like it has for the other version, the earlier version of the vaccine and the booster that was of that same version? I do. Now, in terms of for myself, so no, I chose not at this point to get another a new version, this bivalent vaccine, nor am I planning to at this point. But I have a couple reasons to explain about the details. Number one, I caught Omicron over the summer. And so I received a booster for antibodies, but not just that, but I now have the antibodies that are on the nasal linings and on the respiratory passages because I definitely had those symptoms. So I have that level of protection there. Of course, the fact that I had Omicron now means I have antibody booster antibodies for against Omicron as well. And in addition, my body should be doing really, really well on the T and the B cell memory. Now, of course, I can't prove all of those things, but one of the things that I did is about a month prior to me having the infection over the summer, I did an antibody, an IgG, I'm sorry, a total spike antibody level at LabCorp, and my values were approximately I think it's about 5,000. No, it was about 400, 4,000. Sorry about that. Because I remember 5,000 was the cutoff originally. And we were able to. I'm sorry, that is not correct. I apologize. 2,500 was the original cutoff, and I was at around 1,100. I also know that I did not have the nucleocapsid antibody. That's the antibody that only shows up if you've had the disease, whereas the spike protein would show up whether a person had the disease or the vaccine. So then, approximately several weeks after I had the infection, I checked both of those again. So I did show positive for the nucleocapsid antibody, and my spike total protein antibody went up over 25,000. That's the highest cutoff. So a huge, huge jump. Pardon me. Woo! Something went down the wrong tube there. I apologize. But then in October, I checked again 3 months later. Still greater than 25,000 on the antibodies for the total spike. Still present for the nucleocapsid antibody. So that was about 6 weeks ago. So I know that I have the antibodies, and I know that the booster happened because of the disease. So that obviously I realize is not information that everybody has. Following the antibodies would tell a person that. Obviously, if a person has the nucleocapsid antibodies and antibodies that are so high off the charts that they can't even be read, I do believe that is a really good indicator that a person has good protection. And in my particular case, I would question whether a vaccine would give me any more benefit at this point. Oh. What is your thoughts about DeSantis asking for a grand jury to investigate the COVID vaccine? Okay. So for those who don't know, this week, Governor DeSantis of Florida asked, and through his Surgeon General, the Florida Supreme Court to allow for a grand jury to go forward to look to see if there was any criminal activity on the side of the CDC and on the drug manufacturers, in particular, if there was any false information that was being given out at the time that would be in the question of DeSantis that would have misled the population into thinking that the either the benefits were greater than or the risks were less than what the reality is. Okay, now I am all in favor of investigating and getting transparency and finding out all of those answers because certainly I have not seen enough research to conclusively answer that question. Now, whether it's a criminal activity, that's obviously a much bigger jump in what I would be looking for. I want to know from a medical truth that people are getting the right information. And just as when I presented to the FDA when the vaccines were undergoing for the emergency youth authorization, and in my very first presentation of the three, when I was talking specifically about the Pfizer vaccine, that's exactly what I was asking for: open transparency, open data, enough information so that we can make the best informed consent decision. Do I think that that happened? No, I do not. I think that there's a lot of information that has not been come out. When we talk about absolute versus relative risk, I think that there's not enough information of that. Absolute risk is the danger of having a problem with it, but the relative risk is relative to having the vaccine or not, as an example, and then catching COVID and what the outcome would be. Obviously, there was not a lot known because the numbers were too small when it came during the original clinical trials and the original data relative to the myocarditis, the pericarditis that we know can happen from the vaccines, especially in younger men. But of course, those things can happen from the virus as well. And from everything that I still see, that it's more likely to happen from the actual virus itself, as opposed to the vaccine. Although the vaccine, it did seem to happen most likely after the second dose of a messenger RNA vaccine being given. So if this is something that an independent judge is able to say yes, there's enough information here, and this is and to impanel a grand jury, and if an independent grand jury starts asking questions and is open to looking at all of the different sides and what the CDC's response would be and to see what the manufacturer's response would be, as well as what the complaint is from the state, I have no problem with an investigation. And obviously, this doesn't mean that criminal activity has been done. It doesn't mean somebody's getting arrested for it, or an organization, or fines, or anything of the sort. But in general, I always have been one to find that more information, the better. And if this could be done in a very open and a very nonpartisan kind of way, and we're able to get answers one way or the other, I don't have a particular problem with more information because, as somebody who is very much involved in the science of this and wanting to know really how can I best counsel people, potential information when the next time a messenger RNA vaccine is going to come about for some other disease. And of course, I think a very fair question is, was it the spike protein itself, which we know, whether it's the live vaccine, whether it's the vaccine or the live virus, spike protein is it. So maybe the spike protein is what's causing all of the inflammation, regardless of which way you get it. That might not be there in a future version of a messenger RNA. Again, we don't know, but it would be good for us to have more information. What is the current status of respiratory syncytial virus, RSV, spread and severity, and how can I protect my kids? Okay, so let me first talk about severity. RSV is RSV. Whatever is going around now is not more severe than previous years RSV. Yes, it's true that there is a more likely chance of a young child to catch RSV because of the fact that if people were in more of a lockdown, um, in home, wearing masks, not socializing, there were a couple years where just the virus wasn't spreading. And so we have all of these susceptible young children that are getting hit all at once. So as far as the disease itself is it's a bad disease for some people, for some children. It's also being seen bad in elderly people as well as older people as well. But we know that for most people, RSV for children, it's a cold, can be a bad cold, and sometimes it goes on to bronchiolitis, which is inflammation of the bronchioles, the smaller airways. before we get to the alveoli, the air sacs. We know that it can lead to a pneumonia. We know that people are being hospitalized for it. We know that the hospitalizations for this is much greater than it ever was for children at any point during COVID as well. Now, in terms of the spread, again, that's kind of where we were talking about from that. And then how can I protect my child? So, the protection, there's nothing specific about the protection of RSV unless there was a premature baby or a young baby who has lung disease, where there is the injection that's given of the gamma of the immunoglobulin, the IgG against RSV. So it's kind of like a, in a way, you can think of like a monoclonal antibody, and that can protect people who are at risk. The general population, there's no vaccine for this. They're talking about putting a vaccine together. Of course, we'll see where that goes. But obviously, all the other things we've ever talked about in terms of how do we stop viral spread. Don't be around people who are sick. Don't be, even if they have a cold, because they may not have turned into the bronchiolitis or the pneumonia. The hand washing that we've talked about, open spaces, ventilation, not being in clouds, not being on top of each other. You know, if a person is also an at-risk person themselves, wearing a mask, especially like a well-fitted mask that's more KN95, N95, realizing that a lot of children wouldn't be able to do that for obvious reasons. But those are, of course, are ways that people can be protecting their kids as well as anybody for that matter. Okay, next question rolling in here. Okay. And while we're waiting for the next question to come in, Shari, who is our executive director, she is manning the board today as our producer. So she's proctoring this. So she's also filtering through some questions. Sometimes every now and then we'll get a question that's not an appropriate question. So of course we need to have a level of filter, and so that she gets that to me. So as she's loading up the next question here into our chat. Okay. My question is about kids' sinus pressure, pain, and headaches associated with it, which is often the issue during winter months. Besides saline spray and humidifiers, are there any other remedies you can recommend? Okay, so first of all, important to understand that sinusitis, as with any itis, means inflammation of, not necessary infection of, that area. So inflammation of the sinuses. Okay. Um, People are more prone to having sinus inflammation during the cold and flu season simply because there's more cold and flu that can cause inflammation. Bacterial sinusitis is really considered kind of a questionable iffy diagnosis. And, certainly if a person's been sick for 5 to 7 days with fever and the pressure that can happen, in younger children, they don't get the pressure above their eyes, and because those sinuses don't even develop until closer to 10 years. More often pressure is here or in these small ethmoid sinuses that are right to the side of the nose, or the maxillary sinuses, which are right here. And certainly, if you were to tap on somebody and they're like, "Oh, that really hurts," then that's a sign of a sinus inflammation. But because we are dealing with inflammation, and of course, hopefully, somebody would have started the immune support protocol, or vitamin A, and all the other things that we've talked about so many times before, that we've put onto our channel in the past and is now found in the useful info section of our patient portal, as well as on our Patreon page for people who want to be supporters of ours, want access to this information. But since this is about inflammation, we want to be reducing inflammation. Coming back to our gold standards of having good vitamin D and zinc levels, which keep inflammation as a more in check in the first place. But this is a place where, yes, nasal rinses, clearing the area out, getting things in circulation, that can be very good. Nasal steroids. Now, medications like Flonase over the counter can be very effective for reducing it. And these are medications that are specifically designed to not get into the bloodstream, to just stay in the on the lining of the respiratory tract, upper respiratory tract. So it doesn't have the same concern as doing an oral steroid. Although an oral steroid certainly would help as well, but obviously we're more limited to that. That's the thing that's not over the counter. But it can be very effective in a short course of even oral steroids. I think is a pretty safe thing to do. Other things like such as curcumin and high dose omega-3 fatty acids, again, can have more of that anti-inflammatory perspective. Blowing the nose as much as you can, especially if a kid can, keeping that airway all clear as well. That too can be very helpful. Okay. I would certainly not be opposed that if a kid had a cold and then a few days later it was, well, maybe it was more of a sinus infection. If they'd been a few days off of the high dose vitamin A, I'd be very okay with repeating another 2 days to see where it goes. Typically speaking, though, if once a kid hits or hits about the 10 days, if it's constant, nonstop, relentless runny nose, etc., then that is maybe where you do call it a sinus infection. And then are there sometimes proper to use an antibiotic? Absolutely. But at the same time, almost all of the times when people are told that they have a sinus infection, it's not necessarily a bacterial infection and the antibiotics. In fact, I was even taught back, and this goes way back to my day of my days in my in medical school. So this is like 91 to 94, and I remember that their ear, nose, and doctor told me that the running joke amongst ENTs is that if you put somebody on antibiotics for 3 weeks for a sinus infection, they'll I'm sorry, if you put somebody on antibiotics in 3 weeks, they'll get better. If you don't put them on antibiotics in 21 days, they'll get better. So that was kind of like what our professors taught us when I was in medical school. And certainly more and more information has come out to say, is antibiotics just a placebo? Is it something that's really necessary for the long term? But nonetheless, that's, eventually someone does decide, oh, we need to do it. And how many times have I seen it? And, that somebody else put on an antibiotic and they were fine. And I'm like, yeah, well, we don't necessarily know because you were just a few days into this, whether you would have gotten or your child would have gotten better anyway. But nonetheless, those are kind of some of the remedies that I do use for that. And sometimes it can be helpful. I read about a new study showing that mental health of children K through 12 has continued to worsen over the past year, according to teachers, school administrators, and parents who participated in the study. What are your top suggestions for helping me support my child's mental health? What cues should I be looking for, and what actions can I take? Okay. So first of all, we're usually talking about things like anxiety or depression. Okay. And it is important to know that, especially in younger children, younger adolescents, they may not manifest it in the same way as an adult would. Okay. Sometimes they just may become more withdrawn. Sometimes they may not want to be as social. Sometimes they may not be sleeping well, or they may not be eating well. So those, and like they used to. So that would certainly some of the earlier signs that something may be going on there. And of course, but speaking with a pediatrician or a pediatric provider, getting, speaking with a school counselor who may be able to do those types of assessments. Of course, the ultimate way is having an assessment done to know if one of those conditions are there. Okay. Now, of course, anytime that there is a mental health issue, although in mainstream medicine, so often medication is the first thing to run to, there really needs to be a mental health counselor, licensed clinical social worker, a psychologist, somebody who understands children and these conditions need to be involved in order to help them through their thought processes, how to take a more mindful approach, how to be able to recognize when they're going into those either darker or more anxious or panicky moments, and how to divert their attention, make their minds be in a better place so that way they cannot go into the deeper part about it. So, but of course, if a kid sometimes they may say, I feel like my heart is beating fast. That could be a sign of anxiety or a panic attack. If they seem really kind of jittery or on edge, that could certainly be something. Not sitting in their seat very well, that could be that. And sometimes kids will just say, I feel really nervous. And it's perfectly okay to ask a child who is experiencing these types of symptoms, hey, how are you feeling? Do you feel like any butterflies in your chest that are like something that's going on there? Are you feeling worried about something? Sometimes the word worried is a word that they'll understand more than depressed or anxious, necessarily like that. But if you do see any other kind of like changing of behavior, more hyperactive, acting out in it sometimes in an aggressive way, acting out or being more irritable overall, sometimes then that can be part of it. And of course, if you're seeing them withdraw from their friends, withdrawing from the family, withdrawing from the teachers, not speaking out in class the way that they normally would, those would also be signs that there may be some, especially on the depression side, but anxiety too, because they may be anxious about answering a question or not getting the question right. Sometimes this could even manifest itself as doing poor in school itself. If they're worried about something, they may not be able to pay attention and to focus on the work at hand, and their grades could suffer as well. Now, in terms of, we do a lot in our practice, obviously, from a more natural perspective, because of course we're not the ones who are necessarily going to be jumping into a pharmaceutical for somebody, but there are certainly things that we can be doing that can be helping along the way. Things like Epsom salt baths, like the green tea amino acid extract called L-theanine. Lots and lots of benefits we see from CBD, and a newer kid on the block, if you will, CBG, another a non-THC, non-intoxicating cannabinoid that often works in synergy with the CBD as well. Okay, so we're loading up our next question here. I am going on a Christmas week cruise with my fiance's family. This seems like the most high risk time to be going on a cruise in light of COVID and the flu rates and people traveling from all over the country and world. I had COVID early in the pandemic and have received all vaccines and available boosters, including the bivalent booster. I really don't want to catch a virus on this boat. What can I do to best protect myself? Well, you didn't mention in terms of influenza vaccine, but certainly that would be something that I would be, of consideration of if you're looking to protect yourself. We don't really know quite yet as to how protective that the match is for the flu vaccine, but certainly it provides some protection for a lot of people, may decrease the severity of the disease if they get to. But let's face it, if you're gonna be with a whole bunch of people, that's how viruses spread. What can you be doing? Spending more time on deck, where you're in an open area as opposed to in a more closed environment. Obviously, it's different if you're sitting at a table that is nicely spread out in a dining room as opposed to just on top of each other in a bar. That would certainly be a difference. Of course, if you're super concerned for yourself, wearing a high quality, well fit N95 or KN95 type of mask, because we know that that's still really kind of the best protection for somebody. We're not going to expect everybody else to be wearing masks because we know that the ships are not requiring those, hasn't been for a long time. And of course, we know there are not testing going on for the different viruses. And of course, beyond flu and RSV, there's para-influenzas and rhinoviruses and all other types of viruses that typically go on this time of year. Okay. So, of course, the immune protocol that we talked about, what I would consider doing is, again, taking our vitamin A, maybe starting, as the start of the immune protocol, starting maybe a day before, even if you're flying in for the cruise, or starting for a couple of days before you get on the boat, continuing the immune protocol all the way through until a few days afterwards you get off. Maybe if there was 4 days off and you want to repeat the vitamin A for 2 more doses in the middle after taking a few days off, and maybe even doing it again right when you get off another 3 to 4 days later in case you were exposed to something after that, that could be very helpful. But gosh, I mean, I've traveled during this time. I've been on cruises many times. We know how to take care of ourselves. Again, how's your vitamin D and zinc level going into it in the first place? I think that's a huge thing. But of course, living in a plastic bubble, or always staying on deck or only staying in your cabin. Obviously, if you're going to be potentially exposed, nobody can guarantee that you're not going to potentially contract something. But what other things would I be considering doing? Bringing extra Tamiflu on the boat in case this is something of a more flu-like symptoms, or bringing the Paxlovid on the boat, just in case you start to have more that symptoms. Bringing the swab on, so if it's positive, that you can test for it. Those would also be things as well. Our parents, they did catch COVID coming off of a cruise this summer. Now, it was Omicron. They both had been vaccinated. They both started the immune protocol right away. They both took Paxlovid. They did phenomenal with it. I mean, realistically, both of my parents have had just cold. I mean, it was a basic cold. And we are talking about people who were pushing 80 years old who do have some health issues of themselves. But, thank goodness they did do quite well. But of course, as soon as they started with their first sign of symptom, we made sure that they were taking all of the things that they needed to do, and they did quite well. So, we are in a time when we are endemic, and this is going to be around for a while. And we are now, our conversation is shift to living with the virus, especially COVID, as opposed to being able to completely avoid it. And that's kind of really more the way I would be thinking about this. And Hope you have a great trip. I realize it could be a little unsettling about that. I totally understand if you're trying to wanting to be with the family, and maybe the only time during a year a lot of us can only get together once a year on that. So I totally understand that, but I do hope that you have a great time. In light of increased chances of the electrical grid going down, in those types of situations, do you have some shelf stable probiotics that you can recommend in place of Saccharomyces boulardii and Probio Gold? Okay, so first of all, probiotics do not go bad right away if they are at room temperature. In fact, an unopened bottle will actually go much longer once it's been exposed to air. The feeling is that every day it may lose at most 3% potency or 10% over a course of 3 days. And of course, if you're talking about taking a probiotic that's, I don't know, 40 billion and you've lost 10% and it's 36 billion a few days later, that's still going to be plenty. So, unless you're talking about the power grid being off for a couple of weeks, obviously we saw what happened. Was it North Carolina, South Carolina, where it was a better part of a week, then that could be an issue. But there are also shelf stable types of products. The way that you best know that it's a shelf stable product is if it comes in its own blister pack. So as opposed to just a bottle of pills, it'll typically come in a box, and just like some medicines, we have to like push through the foil in order to get it. Those are shelf stable products. You'll see it right on the package, and those would be okay to be having on hand and to be taking. And the viability, the strength of those products should not be declining at all. Okay. Are sacral dimples and tongue slash lip ties signs that there wasn't sufficient folate levels during pregnancy? Okay. So the having a folate deficiency during pregnancy, where we talk about a sacral dimple. Now, a sacral dimple is a little depression right at the kind of like the base of the spine, kind of a little bit above the butt crack. Okay. Now, not all sacral dimples are a problem in the first place. Yes, it can be sign of spina bifida. One of the ways, and this is something that every pediatric provider knows, is when you spread open, not the butt crack, but the like where the dimple is. Can you see the base? Can you see full skin in that depression? If you can see full skin, this is not a problem. It's only as if it seems like there's a tunnel tracking in and you can't see it. That's where there's more of a concern that the spinal cord could be involved. And yes, having a folate deficiency during pregnancy can be an issue. And there then becomes the question of what if a person has an MTHFR mutation, especially if they have like a double C677T, and they're not able to activate the folate to methylfolate, that could potentially be a problem. And one of the kind of the telltale conversations when it comes to this issue are what are referred to as midline deficits, things that are happening here down. So that's why, again, on the spine, lip tie, tongue tie, those are where some of those things are coming. Now, of course, it doesn't mean everybody. I mean, I've certainly evaluated plenty of babies, and especially with some nursing babies, the lip ties and the tongue ties can make for an improper latch, and it could make for painful nursing and blisters and bleeding, unfortunately, as well. Granted, a lot of those times it's just a matter of making sure that the latch and the positioning of the baby is right in the first place, and we can check those things very quickly in our office and make those types of modifications. But of course, there is this possibility as well. So, that's kind of why when we developed our prenatal multivitamin with Kirkman for the prenatal, why we decided we would put methylfolate in it in the first place. So, if you don't have an MTHFR problem, but you take methylfolate, you're not at any deficit. Your body would have made it anyway. And if you didn't know if you had an MTHFR mutation, and in fact you did, taking methylfolate as part of as the constituency of the folate in your prenatal, that would of course overcome the problem as well. So, how do you prove of cause? That would be really tough. And I certainly wouldn't say this definitely happened because a person had an MTHFR. And for that matter, I've seen people who have had only one mutation or more, or even less convincingly, the A1298 minor, which in and of itself probably isn't causing a problem. Although I've had many families who've said we have MTHFR in our family, and it turns out that it was a single MTHFR A1298C, and none of the C6, 7, 17, and one normal. That's not going to cause the problem. So, again, I know that there's a lot of information out there, but it's important to make sure you have the accurate information. I've always been told that I should get a yearly wellness exam. If I am a healthy adult, why is this necessary as I'm healthy? Okay. So it's important to get an annual checkup for a few different reasons. Number one, things like hypertension can happen in healthy people, high blood pressure. And if you're not monitoring that at least on an annual basis, we know that that could be an issue. We know that there are people, especially if we're talking about adults, who, even if they're completely healthy, there are a percentage of people, smaller than people who don't have healthy lifestyles, who can show pre-diabetes. The hemoglobin A1C can start to go up, not in, and there's the pre-diabetic range before it gets to the diabetic range. And it would be certainly a great idea to know if it was in a pre-diabetic phase as opposed to getting to a diabetic phase. But also, working with hopefully a provider that you trust, that you can have like a good conversations about lifestyle, making sure that you're hitting the marks that you need to for proper exercise, exertional exercise, reviewing your diet, and just making sure that you're getting your proper nutrients, calcium. So many people that I know who are wanting healthy lifestyles, and so they go dairy free, but I can't tell you how many times I look at a person's diet and I'm like, where are you getting your calcium from? And then they kind of sheepishly say, that's a really good question. It's a good thing to have that conversation about that. Obviously, certainly if you're going to have lung problems, you're going to hear about it. But there are times that murmurs can appear that may not be causing symptoms at that point. Of course, there can sometimes be arrhythmias, an extra beat or an extra sound there. And again, those things may not become problems, but it could be something that would be could potentially turn into a problem as well. Making sure that a person's weight is staying stable, that they have a good healthy body mass index. Of course, if you're a athlete and you have a lot of muscles, we know that body mass index is not necessarily the actual number itself, may not be accurate. Most NFL players have high body mass indexes because they're so stacked. But has it changed? Obviously, an adult, their height hasn't changed, but if their body mass index is going higher, which is usually happening from their weight, then that would be a good thing to know about if they're kind of creeping up there. And if may not realize, pardon me, if you gain 3 pounds this year, you gain 3 pounds next year. You look in the mirror, you probably won't know that you have 3 pounds extra on you. But if that went on for multiple years in a row, maybe all of a sudden you put 15 or 20 pounds on, but you didn't notice it. So having that type of regular checkup, and also, being able to check in with somebody just on your lifestyle from a mental health perspective, checking in on, how your relationships with going, how stressful is work, asking good questions about things like anxiety and like depression, knowing about those things, checking in, are there any things that came up in your family this past year, in the past couple of years, any cancers, types of things, autoimmune conditions, things that a person would want to know if that was a family history of, because that does present a higher risk of developing those types of things. Obviously from a female perspective, wanting to know, how are your menstrual cycles? Are you in fertility mode? Are you having any issues that's there? Sometimes people don't, come to think of it, I have been skipping my period. It doesn't become a big deal for me. So I forget. And the next thing I realize it's a month later. So, having somebody who you can ask, who you can go through these types of questions with. Also, obviously, the better, for me, the better. And one of the important things about seeing a patient is I get to know the patient. So, if I'm seeing a person on a regular basis, I can pick up on little things, but also just knowing what a person's desires are or what a person's trends are. That's something really hopeful. I mean, I have so many patients who may come in the door, and because we have this long-term relationship, hey, I know we were focusing on this before. How have you been doing with this? And saying it in the type of way that can be helpful. Unfortunately, most doctors will, or a lot of doctors, you step on the scale in the wrong direction, and all of a sudden they're browbeating somebody about their weight, which that helps nobody. So that's why, in my opinion, it's important to have regular checkups and not wait until you get sick or just waiting 5 years. As of course, even as we get a little older, making sure that some of the other screens, as a woman, are you doing your monthly breast checks? Once you get to a certain age, have you started doing mammograms? The colon test that we're doing for colon cancer, doing a skin exam for an adult, making sure that there's no lesions that could be precancerous or something like that. That again you can do, because because let's face it, unless your spouse or your partner or whatever is checking your back, maybe you don't know what's going on in your back because you ain't seen what's going on back there. So I think I've made a reasonable case as to why annual checkups would be helpful. How can you tell the difference between RSV, COVID, and the flu? Well, the most assured way would be a test. And a lot of the labs we use a lab here that can check for all of those influenza A and B along with COVID and RSV, so that if a person does have symptoms, that a swab will be able to one single swab now can actually tell that information. They're not rapid tests, and of course, if a rapid test were to be done for flu or for another virus and COVID, etc., and it shows positive, then of course that would be a way of knowing what you have. But there can be some differences relative to the symptoms. Okay, if a person is having more of a wheezing like symptom, more likely it's RSV. If a person starts off with just more of a general cold that kind of goes into some of those things, that's where RSV can be. That's where COVID could be. If you get hit like a truck, where all of a sudden, bam, you are just floored, whether it's in extreme fatigue or aches and pains, severe headache, high spiking fever, that's more likely influenza. But para-influenza, which is another virus that we didn't ask about here, but para-influenza can cause all of the same symptoms as the flu. That's why they call it para-influenza. And of course, there are a myriad of other viruses that are out there as well. But those are really some of the things. Now, why would a person want to know whether they have one of these things? Realistically, the main reason would be if they were interested in taking a viral specific medication. So if you had the flu and you wanted to, and you would take Tamiflu if you were positive, of course, and you really should be checked within 48 hours for that. If a person has COVID and they want to advance their care by taking Paxlovid, which needs to be started within 5 days of start of symptoms, then that would be another reason why you would want to check. But if you're the type of person where you're just going to kind of play through it, I know that I am sick, I'm not going to be around other people, I'm going to have to avoid my holiday or whatever with the family because I'm sick and I don't want to be exposing anybody, then the most important thing at that point is looking for and watching for severe symptoms. Difficulty breathing, shortness of breath, rapid breathing, really feeling way out of it, mental status changes. A couple of times when I've caught influenza, I've literally gone encephalopathic. I've had ringing in my ears. It felt like my brain was on fire. I really couldn't have really good conversations with people. I was really just messed up in my head. That's the reason why I do choose to get an influenza vaccine every year. I've handled the vaccine very well back in my medical school and residency days. In all honesty, I would do that every year versus the couple of times when I just went so bad with influenza. That's an easy thing for me. For me, COVID was a walk in the park compared to influenza. I do not want influenza ever again. Of course, my own self being a pediatrician, I've been around so much RSV in my life. I would imagine I have to have super, super duper immunity against RSV. But of course, that's me because of my job. I would imagine a lot of elementary school teachers or preschool teachers probably would be the same way when it comes to RSV as well. But, knowing those differences, it really kind of depends. But whatever you're going to do, what are we going to do? Start our immune protocol. Start that vitamin A right away. How are we going to try to minimize the disease? Have good vitamin D and zinc levels. All right. I know I'm sounding like a broken record, but there's a reason for that. Okay, we have 2 more questions, it looks like. I'm thinking about trying a gluten-free diet. I did it in the past and it didn't seem to change my symptoms, but that was many years ago. How do I know if I should try? What symptoms might it help eliminate? Okay. So there is not one particular symptom that celiac disease or gluten sensitivity will cause. Now, certainly, if a person has true celiac, you're probably having diarrhea with consumption, maybe bloody stools, mucousy stools. Those could be pretty obvious. Okay. But we know from a mental health perspective, we know from an autoimmune worsening perspective, we know that gluten can cause regular allergy types of symptoms, and all of those will present in a very different way in the first place. Now, of course, there's always the potential that you might be reacting to gluten and didn't feel better because maybe you were reacting to something else. When we first got started in the autism world, we would talk about a casein, which is a cow milk protein gluten-free diet. Then we discovered that soy can cause it again, could cause the problems as well, because although one's from a bean and one's from an udder, that it turns out that the protein chain of soy and of casein are remarkably similar to each other. So, one of my mentors, Dr. Baker, had once said, if you're standing on two thumbtacks and you take one out, you don't feel half better. You're going to still feel potentially all of your symptoms. That's the reason why a lot of times, if I really want to get to the bottom of food sensitivities, why I do a formal elimination reintroduction diet, where we have people eliminate all of the foods that are potentials, including the foods that people eat a lot and crave. That can be it as well. It can be very difficult to do, but then we give it a couple weeks, 3 weeks, and see if there's a clinical improvement. Then if we are, then we bring them back one at a time to see what the trigger is. Now, fortunately, the number of gluten-free foods that are healthy, because a lot of the other breads and some of the pastas that are very rice, very processed, could be not so healthy for a person and their carbs and their etc. But now that we have other types of things available to us, especially squash spirals instead of pasta, amazing. The types of bread substitutes that are now available, again, so much better than what we had available to us in the past. But really, to me, the best way of knowing is giving yourself a few weeks off and then bringing it back, recognizing that if you're stepping on two thumbtacks, one tack out isn't going to be the answer you're looking for. Okay, so I think we're queuing up our last question here. If my child has a cold, how do I know if when they should take him to their pediatrician? Okay. So a regular plain old cold, we don't want to see in the office. Hopefully you have started the immune protocol before you would even ask yourself that question. Okay. So if we're talking about a common cold, just a common cold, there's really no reason to come to the pediatrician. The concern would be if something secondarily came in. So if you're a few days into a cold and then you spike a fever, then that could be the sign of a secondary bacterial infection. If it's at the very beginning of a virus, then you can't make that call. Of course, if a child has had a cold for a few days and then start spiking a fever and getting serious ear pain, then looking to see if there's an ear infection. That's obviously something that a parent wouldn't really be able to do at home. And it took me a good 2 years of my medical school and residency before I was consistently being told by my professors that I was getting it right when I was making a call for it. So just because you have an otoscope at home, not necessarily going to be very reliable in terms of the interpretation, unless you're a physician yourself and you've done it. Again, kind of as we, the whole, when is a cold? When do you consider it a sinus infection? And usually the answer is if a high fever has been persisting for more than 5 days, or unrelenting, not improving congestion goes on for more than 10 to 14 days. And that's when one would consider it. But of course, if a person's developing more issues, where if a child's not drinking and you're worrying about dehydration, or let's say that they're coughing and can't keep fluids down, or they're coughing and puking and bringing more fluids up, and of course doing things like watching for urine output, tears, moist oral membranes, those of course would be signs that there could be dehydration coming on. And of course, we would want to know about that as well. Now, we don't necessarily have to see a child for that. We want to talk to you about it and talk to you about proper oral rehydration and further assessment, because probably if things get bad enough, then an IV may be needed and electrolytes may be needed. And that's probably more urgent care, pediatric urgent care, or a pediatric emergency room type of thing. There are some offices that are set up to do those types of more blood tests. Those are usually larger practices, unfortunately. Not something that we're able to do in our office. All right. Wow, that was quite a variety of questions we have today. Thank you, everybody, for participating. Thank you those who's offered questions. We do allow for people to send questions even in before this. We like to be able to organize that a little bit. So please do that in the future. We will be sharing this video. We'll also be breaking up into little snippets that will be more on the that will be more specific to a particular question. For those who don't know, I have made my foray into TikTok, where I'm doing more shorter types of videos. I'll still on my YouTube channel be putting much more substantive types of things, but I realized that sometimes I want something right off the bat happens that I hear about that I want to talk about, or that I want to react to spontaneously. So I'm putting those kind of more quicker, less produced types of videos up there as well. Please, if you haven't already, subscribe to this YouTube channel, hit the notification button so that you know whenever we put something new. We are really trying hard to put at least 2, if not 3, mostly 3 episodes up a week of some sort. And I know that a lot of you guys find this to be very helpful. And I know that so many people tell me we're not getting this information from anywhere else. And so I really appreciate you following. I appreciate that you want to hear what I have to say. I wouldn't be doing this if nobody wanted to hear what I was saying. And I really enjoy sharing what I know and what I've learned through the years with people who want to hear about it. So again, also, we are showing up on our other social medias as well. So however you like to get your information, just follow us and we will continue to be putting out the information that you want. Have a great day and have a great holiday season. Bye-bye.